Neurinnov is working to restore hand movements for patients with complete tetraplegia following high-level spinal cord injury.
The first clinical indication Neurinnov is aiming at is relative to restore hand grasping for quadriplegic patients. That means patients having a high-level spinal cord injury. We aim at giving them back autonomy through the possibility to grasp and manipulate objects, and so performing daily activities.
The challenges for such an application are each patient is different, and so you have to target and to personalize the technology and the settings for each patient. And so this is the first main challenge. And the second one would be that the solution is really easy to use and easy to implant, for instance, for the surgeon. So to go through the surgery as fast as possible. And so we are really working on these two main issues first.
Yes, we started the production of our technology last year in terms of industrialization. We are around 60% has been done. The main issue of this stage is the production of the implant itself, I mean the implantable part of our device.
We use Cadence for all our microelectronic research and development. If you look at our implant, at the core of it is an integrated circuit that we designed, and that is a key to our technological innovation. So this integrated circuit was built from the ground up by Neurinnov using Cadence tools. A lot of the team worked with Cadence tools in the past, mostly in public research laboratories, and it was a natural choice for us to keep working with them because we knew how to use them, and we knew that they would be up to the tasks and to the challenge that we would have to face.
To achieve this goal, this complex goal of selective stimulation of the nerve, you need high-level technology. In particular, you have to target and focus the nerve activation, and to do so, you need a circuit, a dedicated circuit that is able to focus the currents, to shape the currents in 3D, to have some complex waveforms, and the only way to do so is to go through an ASIC development. And in this area, you need software to do so, and Cadence is the key software that we use to develop the ASIC and the surrounding things that we need. And without this, we cannot go through a very efficient, very small, very energy efficient system.
Our device is a medical device, which means we have high standards in terms of safety or reliability, and this means that we have to leverage Cadence tools to show that we meet our requirements in terms of functionality, but also safety and reliability. We use Cadence tools for all the phases of our design and development. So from RTL coding for digital schematic input to synthesis and place and route with VDI or Virtuoso to full chip analog mixed signal simulation.
You know, when you have no way to move your hands and to use your hands, you are depending on third person and on caregivers all the days, 24 hours a day, 7 days a week. And so if you can get back some movement of the hand, you can find again some autonomy. And so this is in this way that for this patient it will change the world.